As we are fast approaching the end of the year, it's time to educate you so you can make informed decisions based on our last discussion. And to my left and to your right is none other than Dr. Nelson Makemba, the founder and the GP at Nesha Medical Practice. Welcome, Doc.
Thank you for having me once again on the platform, and I'm looking forward to another yet interesting conversation today.
Always,
Yeah.
always. We are almost towards the end of the year, Doc. And it's important for us to know that, when we educate them, it's different discussions and topics.
Yeah.
Which topic did we highlight for today?
Today we're going to be talking about pain and the management thereof. Yeah.
All right. Pain, we're all going to go through it, be it if you're young or, when we're heading into we're not going to say the ages, but when we grow older, pain is inevitable. Maybe let's define what kinds of pains there are.
There are different types of pains, but broadly you got psychological pain and physical pain. Physical pain is the obvious type of pain. You could get that if you hurt yourself, if you fall, your bone is aching, you broke a bone or something. And also with age, generally the bone integrity changes as we age, and tend to get these back pains and all kind of stuff. And also it's commonly seen in individuals that are, maybe having a little bit of overweight and all that kind of stuff. Then you have the psychological pain, that's the most difficult one that comes with, maybe, emotions of, being disappointed, being hurt, not being heard enough, being overlooked. Those are the kind of psychological pain that also might come up with depression and all kind of, challenges that we tend to see on a daily basis. Yeah.
There is a word called multimodal pain. There's a pain management for that.
Yeah.
Let's elaborate more on that, Doc.
Yeah, a multimodal approach in pain management basically, is a concept where we try to tie in, the sort of, pharmacological versus non-pharmacological. Simply put, managing pain either using medication and, alternatives where you don't use medications. By that, we mean, for instance, if you go to see a physiotherapist, for instance, you go to a chiropractor, for instance, or you go for an acupuncture, or go to a biokinetics where you exercise. All of these platforms can offer you pain relief, when you engage their services, but this is now non-pharmacological because they are not using drug management. And the pharmacological or the conventional approach is the one where we, oftentimes, engage on a daily basis. You walk into your doctor's office, you go into a clinic or primary healthcare services, and then maybe you have a headache, for instance, and I prescribe a medication that is able to take care of your headache. That's a sort of a pharmacological approach. Now, we try to sort of marry the two and also tailor-made to an individual depending on what the type of a pain that we are dealing with, so that they can complement each other in helping this individual, feel better, and, we can sort of deploy them as a strategy to help them relieve the pain. Yeah.
Doc mentioned something which I'm going to summarize is more by saying the traditional way or the non-conventional way. What would Doc recommend? Is there one that's better than the other? Do you have to use them together, or what would you recommend?
Yeah, I think by far in clinical practice, we tend to sort of, deploy them together. They sort of complement one another. Again, like I highlighted to earlier, it's a tailor-made approach. It depends on the type of pain that you're dealing with. Oftentimes, when you're especially looking at chronic pain, especially as we grow older, the back pains and the hip pains, those tend to do well with drugs or with medications, but also, for a longer term, better outcome, probably doing a physiotherapy, for instance, or going to a biokinetics might actually be, advisable, or even having an acupuncture or a chiropractor, sort of, go and work on you. Those, then become complementary to one another. There might be a place where you might, use, one independent of the other, depending on the need as well. You also tend to see it, particularly if individuals have had an operation, for instance, they tend to experience pain as well. A pain from a cesarean section, for instance, that one might just need medications. You probably don't need to go for a physiotherapy because your cesarean section scar is painful. It's understandable you have been operated. So those type of pain, you just give you a tablet to take, and that might ease the pain. And as the wound heals, the pain sort of disappears. If you have been involved in an accident phase, maybe, and you've broken a bone, and now the orthopedic surgeon fixed your bone. Now, one of your journey being nursed back to being healthy and strong and able to being, ambulatory and moving about without pain is probably going to, physiotherapy, for instance, But then physiotherapy alone might not necessarily be the best. So we package it together. We give you tablets to take care of the pain, and then you go to physiotherapy. It sort of exercises you, keeps you, mobile, so that you don't also lose function. And then, by the time you are fully recovered, you are doing very well. So you will find, at will, clinicians will then choose, whether to use this type of approach, uh, together or concurrently, or pick one over the other depending on the need, that is, before you.
No. Well, I appreciate the practical illustrations to understand a bit more. In this day and age, we're also speaking about the innovations, Doc. Oh, so many new things are coming into the market, so many things that relieve you from pain, and we're advancing.
Yeah.
Let's maybe touch on the advancement of these medicines.
There has been a lot of innovation taking place, and also it's probably also important to highlight that we actually have, individuals that can train to become pain management specialists nowadays. Um, and if you look, you got, for instance, your opioid versus non-opioids, you got opioid alternatives, you got patches that we tend to prescribe nowadays, that individual can just sort of plug on their body, and then, whatever ingredients keep them from the pain is absorbed through their skin pores into the systems. Um, and then you got, injections that can be given, intrathecal injections, and you can even get spinal infusion given, where you're injected, and this is done at a specialist level, with an individual that is trained to do so. So if you look at, how things are done, there has been a lot of changes that have taken place, in terms of management of pain. And I think with the newer drugs that are on the market, some of them, they're actually very potent, and they're able to actually, help you become pain-free, in a shorter period of time, instead of you having to take one tablet and wait for a good 2, 3, 4 hours. Within, a good 20 to 30 minutes, it works. And you're feeling much better, you're up and running again, and you can go about, the activities of the day.
And they're
Yes.
safe,
And
right?
they are safe, definitely. And when we talk about safety, especially in the aspect of opioid, for instance, opioid can be addictive, because of the addictive nature of the opioid. Those ones, we need to be very careful in prescribing them. We probably might need to, select a few individuals that might really need them because of their potency. And oftentimes we tend to prescribe those for a shorter period of time, so that, the individual doesn't take them invariably or for a longer period of time, and then they develop a dependency on them. Some pain medication are also sedative in nature. An individual take a pain tablet, not only do they take care of the pain, and all of a sudden they feel zoned out and they want to sleep. So patients become clever. Sometimes they realize, every time I take this one, when I go to bed, I really sleep good. Yeah, so when they start, thinking of the pain medication that way, that becomes a problem, because we might go into a space where the individual might then want to take that tablet, not necessarily because they're having pain, but because they want to sleep off very well. So those ethical considerations we sort of have to be mindful of when we are, prescribing this kind of, items to our patients.
And that's the last question, Doc, in terms of ethics. How ethical, where's that borderline between, like you mentioned right now, or that example, and also in this day and age where some people even say, hey, there's some of the traditional herbs that help, my health, but they're not legally, on the shelf. So let's maybe unpack the ethics within for a minute.
Yeah. The ethics that sort of, guide us in how we practices. Like, if, for instance, I highlighted to, you find in other part of the world they use, marijuana medically, called medical marijuana. So somebody might be allowed to smoke marijuana for a medical reason. Number one, it might relieve them of their anxiety, of their pain. It might be sedating, for instance. But we know marijuana can also be very addictive, unfortunately. So the kind of approach that you want to create when you are, allowing such practices, for instance, is that you need to be to have a controlled environment where, these things are not abused. And they are then also used really for what people are saying they're using it for. It's a medical reason. Because then if not, people might end up abusing it and using it for recreation and all kind of things. In terms of ethical consideration, um basically based on training and how doctors are trained and how we are trained, depending on, the type of item or drug or medication that you're prescribing, we often have to understand the property, what it does to the body, and if it then has that sedative component to it and an addictive nature to it. You also have to evaluate your patient in front of you, their personality. There are some people that, that if I give this one this type for 5 days, they will take it for 5 days, and when their pain is gone, they're probably going to be free. But then you might have somebody whose personality is probably likely to develop an addiction to something. something. An individual like that, you need to tread carefully, because if you give them something and they figured that this one, is good to go, you might actually see it in their behavior. Every time they come and they request for a pain tablets, yeah, they can actually specifically tell you, no, doc, I want that one, and then, every time is that one. And then you being trained and knowing what that one can do, then you realize, okay, now I think, there's a problem here. So when you have an individual whose personality probably make them most likely to develop an addiction, you can try and sort of, see if you can give something different, that might not necessarily be addictive, but yet is able to achieve the same objective, that is to rid them of the pain, and help them recover, but then, without developing an addiction. Because some of these tablets, if they take them for a longer period of time and they are addictive in nature, as soon as they go off the tablets,
Relapse.
then they have these withdrawal symptoms. It's like the body's craving. If normally you take this tablet at 8 o'clock at night before you go to bed, the next morning, the next evening when you go to bed, it's not there. You'll be gazing in the ceilings, and your body's like, where is that, little white tablets that we normally take? So we really have to be very careful and very considerate in, making decisions, that are actually in the best interest of, our patients. Because if you create also an addicted society, you're going to run into problems. It will drive up, the cost for healthcare. People might need to go to rehabilitation to be able to be weaned of this product. And, rehabilitation services can be very lengthy and expensive as well. Because oftentimes with rehabilitative approaches, individuals have to be, institutionalized. You have to admit them into a facility. That means admission, meaning that you need to cater for them, you need to look after them, need to feed them for the whole period that they are there. So all of this can drive up the cost for care. So we have to be really careful in how we go about doing things.
Doc, that's a mouthful, but we appreciate it's very necessary. And we'll be back for the next edition.
Thank you. And we are looking forward to the next one.
Great stuff. Dr. Nelson Makemba, you can find him at Nesha Medical Practice. Please remember, if there is someone that needs to hear this conversation, subscribe, share the link, and yeah, pop the notification. Thanks for joining us. We'll be back.